It's 8:40, and most of the time when you visit a GP, you might get, about 10 minutes to chat to them if you're lucky. But in a new TV series, one doctor spends more time than that, quite a lot of time, living alongside his patients in their homes to see how their daily lifestyles could be affecting their health.
Yes, Dr. Rangan Chatterjee wants to highlight how things like sleep patterns, diet and stress can have a major impact on lots of different types of conditions. And then what he wants to do is he wants to tackle those conditions with actually not prescribing any pills, any medication at all. We're going to talk to him in just a moment. But first, let's take a look at one of the women he tries to help. This is Gemma.
Meet the Hughes family from Macclesfield. 9-year-old Ethan, 2-year-old Sienna, Dad Simon, who's 45 and an aircraft engineer, and Mum Gemma, who's 34. For 13 years, she has suffered from excruciating headaches up to 16 times a day.
Right in the back of my head at the moment. I want to rip my head off right now. It's like somebody's driving hot poker into your eye, but it's in the back of my head as well. There's no pain. I mean, I've given birth twice, and it doesn't even compare.
You eat that, look after your sister.
Doctors have diagnosed her with a condition called cluster headaches, sometimes referred to as suicide headaches, because the pain is said to be the worst that any human can experience.
Let's have a look.
Oh, it's so distressing to watch that, isn't it? Really awful, awful pain. Well, Rangan's here with us now. Morning.
Hi, Sally.
Hi. You really had your work cut out there, didn't you? We've been talking about these headaches on the programme only recently. People, their life is really restricted by them if they're suffering from them. You don't want to go in and just give a tablet, do you? What do you do?
Yeah, I think Gemma was one of the toughest cases of my career, there's no question. And actually just watching that footage again, it is harrowing. It's one of the most uncomfortable places I've been in terms of being in someone's house, watching them in excruciating agonies and feeling powerless as a doctor. But I think the important thing is that Gemma has been under neurologists. Okay, she's already under regular neurologist care, she's under her GP, but all she's been given is a medication to try and see if it's going to help her. Now, the problem is it wasn't helping her and it was making her feel unwell.
And she was getting these headaches dozens of times a week.
Well, yeah, at one point she was getting between 80 and 90 per week. And I didn't know how I was going to help her. But what I tried to do is take what I call a root cause approach, go back to basics and try and figure out what could be driving her headaches. And I identified about 4 or 5 things and I tackled them all bit by bit systematically. And I hope people see on Monday nights that the results were just fantastic. And probably one of my proudest achievements as a doctor ever is to see how much I was able to help her with those headaches.
Obviously, people are going to want to see it in more depth in the programme. Can you give us a sense of, broadly, what kind of things were they? What were these 4 factors?
Yeah, the 4 factors I did with Gemma were I changed her diet because there are certain things in the diet that can trigger our immune system, that can trigger headaches. So I thought, well, what if there's something that she's eating every day that may be contributing? I didn't know if it would be, but I thought, let's try that. She was very, very stressed, a very busy mum, lots of parent-child classes. She was, ferrying her kids around everywhere like lots of parents are doing themselves. And I needed to teach her how to meditate and switch off and de-stress. I needed to help her to understand how important it was to go for walks in nature. But I also gave her 2 things which often we don't think about as doctors. There were some supplements that I gave her that early studies have shown that a supplement called coenzyme Q10 can help some people with some headaches. Now, it's not going to help everyone, but it's pretty much risk-free, so I gave her some of that. I also got a sense that maybe there was something going on in her neck. So I sent her to see a musculoskeletal therapist and she started getting some therapy on her neck. And it was this combination approach that actually resulted in her getting a, frankly, a dramatic improvement. We got to the stage where it was under 5 a week. Some days she wasn't getting any. And, I'm so passionate that if we start looking for the root cause of a problem, we can actually do so much. And I think what you'll find, I think the viewers are going to find across this series, we deal with cluster headaches, fibromyalgia, mental health problems, childhood obesity. We've got the whole, unexplained fatigue. We've got so many problems, but the take home for the viewer is, and I'm telling you this after about 16 years of seeing patients day in, day out, that I think the majority of what we see comes down to 4 key areas in our lifestyle.
Go on, what are they?
people know about food, right?
Yeah.
Okay, so I always say to people, you've got to eat well, you've got to move well, you've got to sleep well, and you've got to relax well. And the last two often get missed. How many of us prioritize sleep? And you guys must be really early risers to do this job. But for many of us who don't have a job like your own, how many times are we tempted by that extra episode on Netflix, rather than going to bed? And, an extra hour of sleep every night can have a profound impact on your health. We're all wired these days where, we get up, we're back, we're on Twitter, we're on social media, and that stream of information goes on and on for the whole day until we go to bed. And so people need to learn how to relax and switch off. And this is not soft medicine. This is real medicine. If we want to save the NHS, lifestyle medicine is what's going to save the NHS.
If you go to your GP, you get a 10-minute appointment, you're a GP, you know only too well. It's not really long enough, is it, for someone to come with their problems? How do you now help GPs to look at things in a different way instead of prescribing tablets straight away or whatever the medication might be?
Sally, it's a great question. Time is clearly a problem, and I think all the GPs around the country recognise it and are very frustrated that we only have 10 minutes. And I think people are doing a fantastic job in very difficult circumstances. But it's not just time. Even with more time, we are not taught to think about cases in this way. We are taught to, for cluster headaches, we're taught to make the diagnosis and give a pill. We're not taught to look for the root causes. So I've been chatting with the Royal College of GPs. I'm doing prescribing lifestyle medicine courses. So I'm teaching doctors now, and I'm going to do more and more of that going forward. So I can show doctors actually how you can apply this. And some of the doctors I've already taught are applying this within 10-minute consultations. But if you don't know it in the first place, you're never going to think about it. So I think the way we educate our doctors needs to change subtly. We need to recognise we're very good at acute problems. Heart attacks, pneumonias. There's so many good advances in medicine. But I think we maybe can do a little bit better with chronic problems. They don't respond to this magic bullet approach. You have to do multiple things. And I always say to people, think about these 4 pillars: eat, move, sleep, relax. And figure out in your life, anyone watching this, figure out basically, are you neglecting one of these areas? Maybe for the next week, just think about, could you spend 10 minutes every day meditating, or just switching off, or just doing something mindfully? I think it's achievable, and you can really get big results. And people want this information. I get asked all the time from patients, how do we get more? So I'm writing a book at the moment to try and help these patients, because I'm so passionate about the NHS. I think we can save it, not just by pouring more money into it, by recognising that actually it's lifestyle problems that are putting it under strain. So we have to help.
Well, interesting. I have to say at this point, Dr. Rangan helped me by my favourite piece of medical exercise advice is do less exercise. That was the thing I took away from one of our conversations.
Yeah. Can I tell you why that is? Lots of us are just working so much, we're burnt out. For many women that I see, in particular, Sally, I find that they're then, in any spare time that they do have, they're hammering it at the gym. Now, most people, there's no question, need to move more, but some people need to move a bit less or move differently. And I think, Sally, the advice was, cut off one of those high-intensity sessions and do something like yoga. And what have you experienced from that?
Yeah, Zen. It's fabulous. Great. It's changed my life.
Really?
Yeah, you look shocked.
I do.
Yeah.
I feel like I'm crashing a date.
Yeah, exactly. If anybody else
so
wants
much.
more magical information from the doctor, Doctor in the House starts on BBC One, Monday at 9 o'clock. And if you have any questions for the doctor himself, Rangan will be doing a live chat on the Breakfast Facebook page just after the programme. You can type in.
I might message on my ancient phone. Thank you very much indeed, Rangan. Thank you very much indeed. I think we need to spend a couple of minutes meditating, calming down, relaxing. Perfect opportunity, because Matt's got the weather for us. He's on the rooftop today. Hi, Matt.
Morning, Matt.